people have this perception that अगर बच्चा नहीं हो रहा है मतलब it's the wife who is having issues.
Yeah. So if someone is not getting pregnant, their first instance is that if a woman is supposed to carry the child and she's not able to get pregnant, there should be something wrong with her.
I've always heard all our grandparents saying that हमारे ज़माने में तो ये सब नहीं होता था.
होता था. Testing उतनी नहीं होती थी.
PCOS impacts physical as well as mental, everything.
So even now, we do not know why PCOS happens.
Is there a difference between how things are operated in India and abroad?
I think when it comes to fertility treatments, India has some of the best laws.
Going back to IVF, I don't know if it's a myth or true, but it's just for the rich people.
The treatment everywhere will be the same. So it's not like कि तुम कोई expensive center में जाओगे तो सोने के अंडे निकले. That's not gonna happen.
Arranged marriages or love marriages, does that impact how fertility is addressed?
Will it affect fertility? No. I think the best way is to not get married. That's
फिर तो आपके patients कम हो जाएंगे.
Yeah, that's also true. To get married. There are people who still want to come and meet me, and my dad usually goes के अरे मैं बाप हूँ उसका.
मैंने पढ़ाया है इसको.
तो मैं ही करने वाला हूँ. He'll look at your embryos and eggs and sperms. बाहर का सारा काम मैं ही करने वाला हूँ. इधर ही बैठो तुम पहले.
Let's go back to the basics because now we're getting deeper. Deeper. Yeah. Sex, periods, virginity, masturbation, fertility. All these words often shushed away, often spoken inside the room. ये सारी बातें कमरे के अंदर किए जाते हैं, सबके सामने नहीं. Why? Why is that? These are the things that define our relationships, our health, and our existence. Who better to lead this conversation? We have with us Dr. Prateek Makwana, a renowned consultant embryologist and the director of Vasudhara Hospital. Dr. Makwana is on a path to bridge the gap between science and society. As a WHO-Fides member, he is actively contributing towards the global reproductive advancements. He was a young ambassador in 2022 for the European Society of Human Reproduction and Embryology. Whether it's social media or medical conferences or within the community, Dr. Prateek Makwana is on a mission to normalize discussions about sexual health and reproductive health. Dr. Prateek is popularly known on social media as FertilityScribbles with an audience of over 150,000. Well, education is not just about empowerment, it's about liberation. And it's time to talk now. Hi, I'm Sudakshana Chatla, founder of the SAP Media, and welcome to the show Breaking Stereotypes. Presented by the SAP Media, sponsored by Dr. Stuti Khare Shukla's Elements of Aesthetics and production partner Pack Studios. And we have with us Dr. Prateek here. Thank you so much for joining us. Quite popular on social media with the name Fertility Scribbles. Where does this come from and why?
So, yeah, that's a very interesting question. Fertility because I'm in the field of fertility.
Yeah.
Scribble because when doctors write on the prescription pads, it's called scribbling. So when I was thinking of a name, I had no idea what to do. I don't know why I came up with this name, but it just stuck. And I have thought about changing it quite a lot of times to just my name. But then I think this has now become my identity, so I stick with it.
100%. I guess we now know you as Fertility Scribbles. But again, choosing something like fertility comes with a lot of taboo and a lot of pros and cons. And you chose that.
Yeah.
Why?
So I think the field of fertility was something that I grew up around. And I was always interested in this. So when I was in my first year of medical, from then on, I was very clear that I want to get into ARTs. Is the field, assisted reproductive techniques. So I always knew that I want to get into ART. So I think for a first year medical student, that clarity is very important or very new. I was never in two minds that once I finish, whether I'll do gynae, whether I'll do something else or medicine. Like, people have that confusion and sort of it becomes much more clear during their internship when they get to work in different departments. I already knew. So when I was during my internship also, gynae was my most favorite department. And yet I still did not do my post graduation in gynae. I did my master's in embryology and came to fertility from that route.
Do you think
Yeah.
your parents or the background you come from had an influence on what you were choosing?
It was certainly easier because I had the guidance that I needed.
Yeah.
So if I was worried about a certain field or wanted more information, that was available to me, like at that very instant. So that helps. That I think sort of is the privilege of when your parents are doctors. You get the guidance that you need. Everything else you sort of still have to work for because this field is like that. But yeah, just having that clarity at home, I mean, it really helps.
But since the time you chose, like when you were in your first year of your medicals to now actually practicing, how did it change the perspective of people? And do you think there is a demand for such things?
So the perspective has improved quite a bit. I'll tell you an incident from 2019 to now 2025, so about 6 years
Yeah.
difference. In 2019, when patients used to come, they still do, but the idea that they had was that हमको wife का IVF करवाना है because by default the guy is fine. That's what the assumption was. Now it has reduced. Now when they come, they are very open. They come with the idea कि दोनों partners का test by default होना है, so they are aware of that. It could be because of the internet, it could be because of searching before coming to or it could just be general awareness. But it has improved. There are cases where it still happens that women are blamed, but I mean, it's changing gradually. So,
but slow.
It's very slowly, but I mean, there is change. So I think that's important.
But why is that people have this perception that अगर बच्चा नहीं हो रहा है मतलब it's the wife or it's the female partner who is having issues?
So, who bears the burden of the pregnancy? Women.
Yeah.
Right. So if somebody is not getting pregnant, the first instance is that if a woman is supposed to carry the child and she's not able to get pregnant, there should be something wrong with her. Plus, the patriarchy doesn't really help. The patriarchy not only blames women, it also stops men from accepting that they could be in the wrong because they don't want to feel less masculine.
The ego comes in.
Yeah. So patriarchy has essentially messed up with both men and women. So hopefully that changes.
Hope so. But like you said, when they come to you for their concerns, they often feel that it's the woman who's going to undergo.
Yeah.
And it's true that women have to undergo through the procedures more than the men.
Absolutely.
Why is this? Why are there no procedures or treatments for men? And why is it that women has to bear all the pain, all the trauma? Because we know that there's so much around it, mental, emotional. Why is that women are the one who have to go through it? I know patriarchy is the answer for this, but on a medical level, what happens actually?
So there's a very interesting fact that even from a very older time when medicine was developing, all the research was done on male bodies.
Okay.
And then applied to female bodies. So female bodies weren't researched. Okay. So of course they could not understand things like menstrual health, and all of that came much later because men mein to hota nahi tha, so they didn't understand why the female body is going through it. The anatomy was different.
Yeah.
But they applied the male anatomy to the female anatomy. So they only focused on males. But when it comes to fertility, they don't want to touch the man. They only focus on the female.
But that's again in the system.
So now, जहाँ पे research should be there on men as well, वहाँ पे research है नहीं. So every treatment women have to go through.
Yeah.
And where the research should have been more diversified to suit women's bodies and anatomy and physiology more is not there. So whatever treatment was done on the males was applied to females.
So all the pain, all the stuff that you have to go through is for women. And when it comes to men, like, relax, your wife is there to take care of everything.
Like at this point, if a couple comes to the most surgical or invasive the procedure could get for men is when we have to take the sperms out of the testes.
Okay.
That's about it. Till that time, all they have to do is ejaculate in a cup and they're done. All the hormonal injections, the ovum pickup, the transfers, everything will be happening with the wife or the female partner, but the men just have to ejaculate in a cup.
Okay, let's go back to the basics because now we're getting deeper. Yeah. Okay. Um, for people who don't know what IVF is,
Yeah.
especially, I feel there's a lot of misinformation, there's a lot of fear, and maybe people who are actively, searching about it, have friends, are on the internet, know about it, but there's still a lot of misinformation.
Yeah.
And when you look at the smaller cities, the 3-tier, 2-tier cities, people still don't know that there's something like this that they can opt for, and they keep waiting for the right things to happen to them naturally, and then it doesn't.
Yeah.
And also, I want to know, like, if age plays a very important role in this process of IVF.
So, I mean, age is the single most important factor when it comes to your fertility.
Hmm.
And now there are ways to preserve the fertility. So, the effect of age is now tamed to quite some extent.
Okay.
But by default, even now, age is the single most important factor amongst a lot of other things. But age is still the first thing that we look at is the age. When it comes to fertility treatments and people waiting too long to get their treatments, of course, it affects the chances. And what it happens is there's a lot of home science, like कि हमारे ये, try this remedy, maybe it'll get better. And people waste a lot of time in that. Sometimes those home remedies also end up harming the people, which makes the treatment now even more difficult. So not only they have wasted enough time because eggs are limited, right?
Yeah.
So after a certain age, the number of eggs will start declining.
Right.
So not only have they wasted that time, plus they've also tried things which could harm them. It just makes it a lot more difficult. So, but yeah, I mean, the perception of fertility has changed from people considering it it's something against their natural selection, and people going to different cities, especially say in cities like Jodhpur, which is a tier 2 city,
Yeah.
or other smaller cities. People would not be open to going to a fertility center in their own city because किसी ने देख लिया तो बाहर निकलते हुए अंदर जाते हुए. So they would go to different cities to get their treatment done. But now that has changed quite a lot. Now I think people have opened up to the idea, and a lot of it also because a lot of celebrities have gone through IVF. So I think that sort of normalizes कि हाँ वो भी करा रहे हैं तो हम भी करा
हम भी
सकते
कर
हैं.
सकते हैं.
So
Right. I guess when you mentioned the celebrity part, we also spoke about egg freezing, where Priyanka spoke about it, and then boom, it
Yeah.
was everywhere. But it was always a popular treatment outside of India.
Mhm.
How is it changing right now in India? And I know that a lot of young female, they're waiting. They're not waiting anymore to get married and to they're pursuing their careers. They're not thinking about it, and they're choosing this option. If you can just explain us, what is it and how does it go, and what are the benefits of doing that?
Yeah. So like I spoke that there are a limited number of eggs. The eggs that you're
Yeah.
born with will be the ones that will stay for your life, and they'll get used up every cycle once menstruation starts.
Yeah.
So now after a certain age, say 32, because the body has a tendency to use all the good eggs first and leave the bad ones for much later.
Okay.
So as the age increases, the good ones are getting used. Every cycle you don't get pregnant, a bunch of eggs are used, one comes out, so all of them are now gone. Every month, the same cycle would repeat. By 32, the body has used up almost all of the good eggs. By
Yeah.
35, now the number will also decline a lot and the quality will also
Quality
be
also.
affected. So that happens. Now, for egg freezing, what we do is we stimulate a lot of eggs at whatever age the person comes to us, say 28. We'll stimulate a lot of eggs, and then we'll take out those eggs depending on other fertility tests of the patient of what the quality of eggs would be and what the number of eggs would be. And then we freeze them in liquid nitrogen.
Okay.
So that preserves eggs at that point in age. So now if they come at 34, if they're frozen at 28, the eggs that they will be using will be of the quality that were at the age of 28.
28. Going back to IVF, a lot of them feel that there's a lot of mental and emotional trauma that they have to go through. Has it improved, or is medical or the science behind that getting better for women?
The science has definitely improved. Now, I mean, coming from 10 years back using high high amount of doses for a longer period of time to now getting the same work done in lower doses in a shorter period of time, because it also affects the hormones will affect the body.
Yeah.
So the least possible dose that we can give to get the eggs that we want, or to get the treatment or the cycle that we want, is what the trend is right now. So it helps mentally, it helps physically. Also, now there are a lot of support groups, fertility support groups. There are fertility counselors
Yeah.
who help with understanding the treatment, understanding what happens post the treatment. So in that manner, the treatment has improved quite a lot. And the only problem is, I think the only issue still is the hope that people get when they come to IVF. I think that is the one that messes with their mental health the most.
Yeah.
Because people, even after you explain them, people still think that it's 100%. It's not. It's about 40-50% chance. So that, I think, is still something that messes up with the mental health if a cycle fails. And we feel the same, because if we have worked with the patient, we have seen the history of the patient, whatever pressures they have come up with, or whatever reason for their infertility was. And then you see a cycle not being successful. So it affects the patient a lot, and it affects the doctors as well.
And how many sessions or how many times that one has to go through it? Does it depend on their health or the situation, or how is it? Like you said, it's a
Yeah.
40-50% thing.
That we still don't know. Some people can get pregnant in the first cycle.
Yeah.
Some people might come for IVF and do a couple of cycles, not get pregnant. We'll ask them to take a break, go on a vacation. They'll come back conceiving naturally.
Okay.
And some people would probably try for 6-7 cycles and still not see any success. So yeah, whatever the history of the patient is, whatever the physiological and pathological causes are,
Yeah.
they definitely affect the chances. But what can change it concretely, we don't know yet, because we still rely on the 40-50-55% chance.
And there's also, I don't know if it's a myth or true, but it's just for the rich people.
It's pretty affordable. I mean, it does depend on the center and the city you are going to. So if you go to Bombay, and if you go to South Bombay, and if you get your treatment done, it will be more expensive. But the treatment everywhere will be the same.
Okay.
So it's not like कि तुम कोई expensive center में जाओगे तो सोने के अंडे निकलेंगे. No, that's not going to happen. But it is still the same everywhere. The price depends on the experience of the doctor, the kind of center or unit that they run,
Okay.
and where they are located.
I also read this somewhere that people are thinking that IVF से हमें लड़का हो जाएगा.
Where it's legal, it can happen.
Hmm.
India mein sex selection is not legal.
Hmm.
Wherever it's legal, they can choose the male embryo. So after a certain stage, when the egg and sperm meet,
Yeah.
it becomes an embryo.
Right.
And then we can do a genetic testing. It's called PGT, pre-implantation. Implant hone ke pehle test karna. So
Hmm.
pre-implantation genetic testing, where we can see if the embryo is a boy or a girl embryo. And then
Okay.
we can transfer that according to the patient. This only happens in places where it's legal. So it might happen in the US, it might happen in, say, Singapore, I don't know, Singapore, Thailand,
Yeah.
Dubai, where jahan pe allowed hai. India mein it's not allowed, so India mein you cannot do that.
And why is that?
So there's a PCPNDT Act. It's a government body which so, does not allow you any sex selection based on gender, because of the female infanticide that used to happen.
Yeah.
So since then, all sort of sex selection, be it through ultrasound, be it before getting pregnant in the embryos, everything is banned.
Okay.
Yeah.
I guess it's needed in India.
It is required because people still have that mentality that "Ani, humko ladka chahiye," even though the ratios have gotten better.
Yeah.
But
100%.
if given a chance, I think we will probably have cases where the same thing is happening again. So it's
Yeah.
good that it stays banned for now.
Because I feel a lot of people who may also come from a good family background, may have the financial ability to do everything and anything.
Yeah.
They still prefer male child. Like they want
Yeah,
a
that
boy.
mentality I think is still
Still
there.
Yeah, so it's not just like the smaller cities and the
No.
lower class or the middle class people. It's everywhere. Now, while you spoke about the IVF centers opening up everywhere, there are a lot. You can see one in every neighborhood. How many of these are actually regulated? And is the government keeping a check on these hospitals and these
Yeah.
branches?
So I think since up till 2020,
Yeah.
India was in the honeymoon period of IVF. There was no law.
Okay.
There was a guideline by ICMR, the Indian Council of Medical Research, but ICMR is not a statutory body, so they cannot regulate or force or enforce those guidelines.
Okay.
Guidelines, you follow it if you want
Hmm.
to. This is what we want you to do. Simple. 2020 में finally the ART law came,
Hmm.
and the day it came, it asked a lot of centers to, audits हुए थे, inspections हुए थे, and then it sort of all the centers who were doing responsible practice still stayed. So
And the
centers who
others.
weren't doing either shut down or they left or they were scared of what's gonna happen. So now when a center opens, they have to pass certain regulatory guidelines. They have to get themselves registered. A lot of paperwork now is done because the law exists. But up till 2020, I think people were just opening centers like anything.
Why do we need fertility treatments, and why is there an increase in demand?
So there are a lot of causes, even physiological, not
Hmm.
just diseases, which can cause issues with sperm production, with egg quality, and earlier when people weren't aware of fertility treatments, they would keep trying on for a lot, like a lot of years, and they would have the pressure to get pregnant, and all
Yeah.
of this wouldn't turn out. Then they would get married somewhere else, and they would take a divorce, get married to someone else. But if the problem is that with the person who's taking a divorce and getting married again, the problem with persists, the problem with fertility.
Right.
And over time, because of a lot of environmental factors as well, the change in lifestyle from them being active back then to now it being a very office based, sitting, sedentary lifestyle, the fertility issues have increased.
I've always heard all our grandparents saying that हमारे ज़माने में तो ये सब नहीं होता था.
Yeah, होता था.
Okay.
Testing उतनी नहीं होती थी.
Okay.
So two reasons. एक तो environmental toxins, how people have sort of moved to a more sedentary lifestyle. The hormones have fluctuated because of eating habits, and the testing has increased. So both of them has led to an increase in people being tested for subfertility or reduced fertility or infertility.
But like you said, there are a lot of centers opening up, but the maximum place where people look for answers is your Google doctor
Yeah,
or your Instagram doctor.
of course.
And everyone and anyone is talking about this. You see people from different fraternities talking about health, talking about fertility, or the other things which are aligned for fertility, like PCOS. There's Ayurveda, then there are health coaches, there's dietary nutritionists. A lot of them are speaking about it on social media. How is this regulated, or is it even regulated in India? And how many people are actually facing uh, some kind of loss due to it, or maybe are getting affected due to the misinformation that's going around?
See, I think social media cannot be regulated, and unfortunately, what happens is that the medical body, the National Medical Council, what they want to do is they want to regulate medical content.
Yeah.
But they want to regulate the doctors. They have no authority over general public who are not doctors, who are still talking about medical issues.
Yeah.
With be it their anecdotal knowledge or just be, you know, themselves learning from reels or Google and then just spewing it out or using chat GPT to write the script for them.
Yeah.
They only want to regulate the doctors. So the people who can give correct information are now uh, trying to do that with one hand tied behind their backs. But the people who can say anything are still going to say anything that they want.
Yeah. So, but we want doctors to come up and speak. We
Yeah.
want doctors to talk about it, because how else are you going to clear the myths and the misinformation
Exactly.
that's going around? So I feel the doctors shouldn't be the one who are regulated, but the other people, the general public, needs to
Yeah. So
be sorted.
every time a lot of us sit and talk because now there are a lot of fertility doctors on
Yeah.
social media.
Yeah.
And it's good because everybody has their different way of presenting knowledge might reach people or interest those people who say my account cannot reach or hasn't reached to. But somebody else's account has reached.
Yeah.
As long as everybody is getting the benefit of it, why not? But yes, misinformation also exists. Unfortunately, amongst doctors as well, there are doctors who might inadvertently just give something out in a manner that they're not supposed to, and it would be wrong. But it's pretty common, it happens.
Okay.
But then there's disinformation, which is sort of when you focus on giving wrong, like misinformation is unintentional.
Right.
Disinformation is when you know the information is wrong and you still promote it.
But a lot of people are doing this. A nutritionist or somebody who has lost weight and suddenly has become a gym trainer is talking about all of these.
Yeah.
They're suggesting supplements and people are taking it. And do you think the lifestyle that we have today, the hustle culture, the late nights, the vaping, does it impact?
Oh, absolutely. Anything that puts stress on your body and the stress is not controlled, if you don't get enough rest and if you don't eat properly throughout the day. Exercise, movement, you're still getting some if you are running around here and there. Agreed. Of course, if that stress is making you smoke, vape, anything like that, over a longer time, it will affect not just your fertility. Like fertility comes later when you're trying to get pregnant.
Yeah.
Before that, your lungs are gone. Before that, this pressure on your heart. Before that, anything can happen. Fertility is only when you try to get pregnant. So,
and does the whole aspect of early puberty is now impact fertility, or because they also are exposed to, like you say, technology or vaping culture and all of this at a very early stage? You see 16-year-olds vaping. Does that also impact?
Of course. The sooner you start, the longer you'll do it, the more the effect would be.
Right.
Early puberty, not as much. Late puberty, yes.
Okay.
So if puberty comes late, that could be an issue. Early puberty, by a couple of years, it's not really bad. It could be good.
There's also a drastic, like suddenly everyone I'm talking to is saying PCOS.
Yeah.
This word is like just buzzing. Then there's some kada made for PCOS girls. Then there's a skin specialist talking about why PCOS acne is happening. PCOS impacts physical as well as mental, everything for a girl. And it's also teenagers who are affected. At a very early stage, people are getting tested with PCOS. Why is there an increase in that, and how does it impact or have an effect on fertility rate?
So even now, we do not know why PCOS happens. What's the cause that starts it? There are over 3,000 genes which have been related. कि उनमें कुछ भी mutation होगा तो it can lead to PCOS, but we don't know why it happens or how it happens. It just happens. Same with endometriosis. We have no idea why it happens or how to treat it or how to treat PCOS. We can manage PCOS.
Right.
You can manage it to live a completely healthy life with no effects of PCOS. But you cannot cure it because we don't know how to cure it.
So you can't reverse it also.
The reversal is essentially management, that you have brought down symptoms to a level that they won't affect your physical life or your mental health at all. That is what we call reversal.
Yeah.
But it's still there. Like if something happens, if something triggers it, if you sort of go away from the lifestyle that you are living, it will come back. It's not cured. We don't have that cure right now. And it has increased. Right now, PCOS is the most common disorder in the reproductive age group, which affects fertility. I think there was a data which said 1 in 8 people have PCOS.
Yeah.
So I'm not sure if it's 1 in 10 or 8, but something like that. And it's true. Almost every other patient that we see is suffering from PCOS. It's lifestyle. It's the kind of food that we consume. A lot of food that people now consume is processed. And it's not like they're eating it once. They've been eating it for years.
Yeah.
The quality of water, especially in Rajasthan, where there's a lot of lead in the water.
Yeah.
And people in the tier 3 or the villages and the townships, they don't use RO filters. So continued exposure since childhood to adulthood affects. There are a lot of things which can affect, but we still don't know what actually makes PCOS happen.
And that means at the end, it's women who are facing it.
Yeah.
Because you said most of the patients who come for fertility treatments are there because of PCOS.
Yeah. The most common defect. But also their partners might also be infertile for some other reason.
Yeah.
So that also happens.
And you spoke about stress. And like you see the generation now or the Gen Z,
Yeah.
we suddenly are talking about trauma, anxiety, depression. We're not able to really process our situation because life is tough. Let's just accept that. Do you think that also the cultural shift in the generation impacts our lifestyle? Because then the next thing you see a person who is depressed or sad is doing is vaping or drinking or doing all the
Yeah.
not so healthy things.
See, smoking, I say, is absolutely bad. Okay. Drinking, yeah, people, I mean, it is bad, but you can, like, if people want to drink, you cannot actually stop them from
Yeah.
drinking. Even if you say no matter what you want to, it's bad, they would still go out and have that one drink or two drinks.
Yeah.
So at least have it in regulation,
Yeah.
as long as you're aware of what you're doing and you are regulating the amount of it, great, good. Because some things once a while would not hurt you. Although there are studies which say that even one drink is enough to cause the similar damage to, say, years of drinking. So yeah, I mean, it's a conscious choice that we all make.
Let's talk about the elephant in the room. And ऐसे बोलते हैं ना हर घर में होता है लेकिन बात कोई नहीं करता है. I remember when we were in grade 8 and so our school was like had multiple branches. So that one head of department came in and she was like, do you want sex education to be included in your syllabus? And this is like, I'm talking about 10 years ago. And we were like, why not? Because it's something that is important.
Yeah.
But then after she left, our head of the school came to us and said, why did you say yes for this? You guys are too young for this. But we already hit our puberty. So that still happens. I don't think so many of the schools are providing that. And when it's done, I remember when we were taught about periods, girls को अलग से लेकर जाके बताया गया था.
Oh, yeah.
नहीं है. So how do you think schools and as a society, we are responsible to give the right information at a very early age?
So there was a movement by the government to include sex education in schools. And it could have happened. But what we do have right now, whatever is like a very superficial program, which is pretty much useless. And that happened because the parents revolted against it.
Imagine.
Like कि हमको ये सब नहीं सिखवाना है बट हमारे बच्चों को स्कूल में हम ये सब सीखने के लिए नहीं भेजते हैं because they still think that sex education talks only about sex.
Yeah.
But it's about the anatomy. It's about learning about your reproductive organs.
Contraception.
Communication,
Yeah.
consent. And then as you grow, then you learn about a lot of other things as well.
Right.
Then sex also comes into play. Of course, it's a part of sex education.
Yeah.
But healthy, safe sex practices. A lot of things that you learn, which otherwise you will be exposed to do these things either way. It's just that the things that you learn then would not be the reality, would be what you see through porn or whatever.
Yeah.
So now, if they want to implement sex education, there are 2 points of impact which I feel exist. One is the parents and is the teachers.
Yeah.
First, you teach them. Once they know, then they'll be able to pass it on to their kids and students. Before including it in schools, it definitely should be in schools and college and universities. It should be a subject. But the parents need to learn first so that they can also help their children at their houses. Every age group wise, you can choose to disseminate information.
Right.
There's no problem. They are doing that with every subject anyway.
Yeah.
And the teachers definitely have to learn so that they don't skip it in school or they don't just like cover it quickly and be like, your next chapter pe chalte.
Yeah. That happens.
That needs to sort of, I think, first teach them so that they can teach their students and kids.
Because I feel that somehow the other way they're going to know.
Yeah.
And like you said, sex education doesn't just talk about sex, but there's a lot that is involved. And due to lack of this information, you grow up to do all the wrong things. And then you're just stuck. And you're also risking your life. A lot of them risk their lives because they don't know what to do next.
Yeah.
So I guess as a society, it's our responsibility to start at home and then schools, because that's where the major education happens.
Yeah. Also, if the thing that you had mentioned, that when they talk about periods to girls in schools, they ask the guys to move out. That's the whole reason why we have so much negativity, so much hate, and so many myths that exist around periods and how people suffer from it, and especially in joint households where say if somebody is going through a menstrual cycle, they won't let them enter the kitchen, or they'll be like,
Yes.
and that creates a lot of problems. These things happen. This is a reality.
It's a lot. Like, I have seen the most modern families suddenly going back home and like they cannot sleep on the bed.
Yeah.
They have to wash their own dishes. They cannot touch anything in the house. They have to wash their own clothes. Don't go to the temple. Don't enter the kitchen. Uh, but that's a lot. And we are in 2025, but it still happens.
And there are people on social media essentially reinforcing these myths by giving whatever spiritual explanations to them. So the doctors are not promoting information right now. All we are doing is damage control. Because for every one good video a doctor makes, or a healthcare professional, or anyone who's trained
Yeah.
in this particular field makes, there are 100 other videos completely against that. So
But is there any scientific reason behind why one should not do these certain things, or not enter the kitchen, or not go to a temple?
there's absolutely nothing to say that this needs to happen. Periods are a very natural part of the
Yeah.
body. It's when your body prepares for pregnancy. Pregnancy does not happen, the body sheds the preparations. It does.
Yeah.
Simple. That's all periods are. I don't know why people go through
No
varying
solution.
lengths.
Were you taught about periods? No, none of them.
Yeah. A lot of people, people in medical field, of course, learn about it.
Yeah.
A lot of people
But
outside.
that's also when you're 18, 20.
Yeah, like after 17, 18, when we joined the
Yeah.
college,
तब
and
तक तो
then
हो जाता है ना.
tab tak to sab, yeah, it's all done tab tak. So
I'm sure you must be seeing cases where even a 16-year-old is pregnant and is coming with.
yeah, because there are, MTP is legal in India, so
Yeah.
they do come with this, and it's worrying.
Yeah. Since you travel a lot, I've seen that you're giving lectures, you're there at every conference possible around the world. Is there a difference between how things are operated in India and abroad?
I think when it comes to fertility treatments, India has some of the best laws.
Okay.
Europe has some of the most archaic laws. Like, they are so hell-bent on their theories from 1980s, 1990s, and they force it on the patients.
They have
force it on the
they've been
doctors.
forcing things on people since very long.
Yeah. Some of the countries have evolved, and they're very free when it comes to fertility treatments. But countries like Italy, Germany, they are very restrictive in sort of the rights of what happens to the embryos, what you can transfer. They still have to improve on that. UK has done a good job. But they're also out of the Europe. So
Yes.
But India in that way is one of the most liberal country in fertility treatments, in medical termination of pregnancies. The US is going on a completely opposite route now.
Yeah.
So they are even trying to ban contraceptive measures. Yeah. So,
What are they up to?
yeah, it's crazy. Like, they're trying to ban the emergency contraceptive pill,
which is going to just increase their population.
So
like
no
left, right,
FTP, no emergency contraception.
I guess they're just scared of how the Indian population is growing. But I feel at where we are, India has a lot of skill, like great doctors. We just need to get the right information out there and use it to our benefit. Because I know that a lot of people from outside of India come to India for their treatments, like medical tourism, what people talk about, that's on a crazy high. Do you think fertility also attracts patients from outside?
There was a medical tourism sector in fertility before the law.
Okay.
Once the law came into place, that sector took a hit. Because India is comparatively pretty cheap in terms of treatment prices to any other country.
Yeah.
And say, if a person would be getting, say, a fertility treatment in the US for about $15,000, India, that's about $1,300. So like 1.5 lakhs is the average cost. Over there, it's 15 lakhs. Granted, insurance pays, but it still comes out of their pocket at the end of the day.
Right.
So yeah, it used to exist a lot, but since the law in 2020, the medical tourism has now declined in fertility. This still is, but not as much. And they used to come for third-party reproduction, which is when the woman does not want to carry and she wants somebody else to carry her baby.
So now let's talk about contraception. There are a lot of myths around that also, especially when it comes to what options that women have to choose.
Yeah.
With men, it's like एक बार हो गया छोड़ दो. But again, women have pills, hormonal pills. There's a lot of myth around that. There's a lot of fear around that. What if it affects our fertility? And then they don't use it. They end up getting pregnant, then go through all the processes
Yeah.
not to deliver the baby, and then back to square one where the fertility is getting affected. So this whole cycle keeps on happening because, again, lack of information. So can you shed some light on that part?
So yeah, for men, there aren't a lot of contraception options available. There's condoms, which is the
Yeah.
most common ones, and then there's vasectomy, which
Yeah.
is a more permanent measure. But now there is a pill in development, which will sort of work like how OC pill works in women. But I think a lot of people don't go for long-term contraception measures thinking that their fertility will be affected. So when I hear about people, thinking of getting intrauterine implants, they think that, oh no, their fertility will be, because an implant can last from anywhere between 2 years to 5 years.
Right.
So for that time, your fertility is covered. Sorry, your contraception measures are all set. But they think that by the time, because of course, like it's acting as a contraception for so long, our fertility is affected. Same with OC pills. People think that if they take it, they would never regain their fertility.
This is again all for women.
All for women, yeah. Condoms work in a very simple manner, but condoms also are the only contraception which prevents against unwanted pregnancies and STIs. No other contraceptive method would prevent against any infection. Pregnancies, yes, infections, no. But I think just the whole fear of losing their, I don't know, like fertility suddenly has become like a thing of fear now for people, because earlier people didn't think about it until they were trying to get pregnant.
Yeah.
Now they learn about it early, which is good, but they hear only the bad things or whatever's on social media at this point. And it's usually the weird things that go viral, not the information. So
Yeah, that's always. I also feel like my parents or our parents, whoever were at that generation, they had a very planned thing, family planning,
Yeah.
So they were also aware and they chose.
Yeah.
Then why is the generation now having all those fears?
I think more than family planning, and right now everybody wants to make money, want to develop their career, which is okay.
Yeah.
Do it. But now they look at family planning as something that, that they'll do when they have time. Like it's not a very important part of their lives anymore.
Okay.
It should be. Because if they plan it, they can get their fertility, frozen. Like they can freeze their eggs, they can freeze their sperms in time, so that whenever they do want to plan, they have their good eggs and good sperms. Even if their lifestyle sort of goes to shit after that, they still have their good ones preserved. But yeah, it's like family planning, people still need to revisit, especially the generation now. Especially like the millennial, like our generation. And
but I also
Gen Z
feel
is too far out.
Yeah. But I feel everyone is so much into it's just one life. Let's have fun. Let's do everything. Let's have the crazy schedules. Let's work ass off. Like you can always beep it. Does that also affect fertility or in general life basically?
It does, but I mean, see, there are people who have crazy work ethic and yet live a healthy life.
That's possible.
Yeah, that is possible. But I mean, it depends from person to person. So if they choose to go with the rule of work hard, play hard, then yeah, they will get hard. I was looking for a word, I could not find it.
That's okay. But I'm sure you have a lot of patients coming in. What are the most bizarre questions or bizarre situations that people come?
We had one patient. This I remember very distinctly even now, which was, I think it was 6 years back.
Okay.
There was this one patient who had come, and of course he had the idea कि मेरे को wife का treatment करवाना है. And it was his second marriage, गांव से, like a little village outside Jodhpur. And so हमने बोला कि नहीं आपका भी test होगा, and we got it tested, and so he had no sperms in his semen.
So it was him.
He was the one who was infertile. The wife was pretty normal. So just in conversation now he mentions कि अरे फिर तो मेरे को पहली शादी के टाइम ही देख लेना चाहिए था. So we asked कि फिर दूसरी शादी क्यों की जब it wasn't happening?
Yeah.
You should have come for treatment at उस टाइम पे. Like सर ट्रीटमेंट का 1.5 लाख लगता है, शादी 50,000 में हो जाती है. So I got married again.
दूसरी बीवी मिल गई
Yeah.
ये अभी भी होता है मतलब
अभी भी होता है. This was 6 years back. It's pretty fresh.
कैसे कैसे लोग आते हैं
Yeah.
okay we'll do like a fun segment now
All right.
yeah, break it or keep it. The fertility edition. This is something very fun, I guess. Egg freezing.
Keep it.
IVF for everyone, even singles.
If they want to, keep it.
Okay. Doctors as influencers.
Keep it.
Homemade dadi ke nuske. For fertility.
Break it.
Sex education in schools.
Keep it.
Not going to temples during periods.
Break it.
Cancel culture.
Break it.
Okay, smoking and drinking as a cool trend.
Break it.
Late night snacking.
Well, I mean, keep it. Certainly. I do that too.
Okay. Got you. Okay. Influencers talking about healthcare. Not doctor influencers, but in general, social media influencers.
I think keep it because there is a slight caveat to it is that it helps people be aware of healthcare in general.
Normalize things.
Yeah. So that when they do look for information, they can find it. But they first have to be aware that information exists.
Yeah.
But yeah, you also cross check what you are listening to.
Okay. This or that segment, again, you need to pick one. Talking about sex openly or keeping it private.
Openly.
Fertility discussions at home or still a no-go?
No, definitely at home.
Men's fertility issue or women's fertility issue? Bigger taboo?
The taboo is men's fertility issue. So yeah, we need to talk about it.
Yeah. Okay. Sex education in schools or learn it on your own? I guess
Schools. Yeah, of course.
Yeah.
Any.
Talking about periods openly or whispering?
Openly.
Condoms or birth control pills?
Both.
Okay.
Yeah.
Okay. I don't know how this plays a role in fertility, but arranged marriages or love marriages, does that impact how sex talks happen or how fertility is addressed?
I think people in love marriages are more open to having these talks. People in arranged marriages should have this talk before they get married.
Yeah.
Yeah, definitely.
I guess it's a...
Will it affect fertility? No. I think the best way is to not get married. That's...
फिर तो आपके पेशेंस कम हो जाएंगे.
I mean, yeah, that's also true. So get married.
Get married and you know who to contact next.
Get married.
Okay.
Get married late.
Yeah. Kids before 30 or after?
I mean, to each their own. Biologically, what medical text states is that before 30 is the right time.
Okay.
But now I think medicine has evolved so much that you can normalize after 30. And people do get pregnant after 30, not naturally as well.
Yeah. Dr. Google or a doctor. A doctor.
A doctor, of course.
But you know, we all, I guess, we're so dependent on the answers from the internet.
Yeah.
No matter even when the doctor says, please use this, we go back and check about it and be like, but you know, I've read about this like this. Should I really go for it? So that still happens. Like even I do it sometimes.
Yeah, it's what we call the WebMD rabbit hole, where you go with a minor headache and you come back dead.
Yeah, like everything on Google is cancer.
Yeah.
Okay. Yeah. Privacy in relationships or social media PDA?
Privacy.
Okay. One partner for life or open to exploring? That's again
I mean, they're both acceptable things. So, yeah.
Okay. So I started following you when you barely had 10,000 followers to now.
2020.
Yeah.
5 years back.
COVID.
Yeah.
And now to where you are, I see that you're at every conference, every talk, every podcast, every interview. How did it change as a doctor to be on social media actively? Because before COVID, there were barely any doctors active out there.
Yeah. So in the medical practice, it didn't really change at all. Like conferences and lectures were still happening. It's because of the work I've done in my field.
Yeah.
But social media did open a lot of opportunities and doors, which I did not know existed. You know, like say giving for TED Talks, working on a book, all of these things I wasn't really aware.
You're working on a book?
I am, yeah.
Okay,
So,
that's a news.
Yeah, I've been working on it for 2 years, so yeah, my editor is now really pissed at me.
Yeah.
But
Is it going to have scribbles on it? The title is going to be like.
title we still have to come to.
Yeah, I guess you
still
should
haven't
have
decided
something
yet.
just scribbled on the cover page. So it.
That's a great idea. I think when we do come to the point where I've actually finished writing it and you want to make the cover page, I will.
You know who to contact.
Yeah, I will use this idea.
Yeah.
But it does open a lot of opportunities which you probably would not be aware of. And I think I also have the first mover advantage.
Yeah.
Because when I had started in the fertility field, there was barely just like one or two other people.
Yeah.
And now there are a lot of people, which is amazing because now I think everybody has sort of understood. Everybody has different goals.
Yeah.
Some have information, some want to promote their IVF unit or their hospital or their fertility sector or whatever. Some people just want to upload their daily life, but as an influencer, being also a doctor. Some people want to make medical meme content. Multiple ways to do it, but now a lot of people have come onto it. Fertility, yes, like almost every fertility doctor I know now is on social media. So the doctors were there, but fertility field was very less represented. Now I think almost everyone's here.
Yes, there's a lot of awareness also. So
yeah, it's awareness plus you do see a shift. Like now when I go to the meetings, the societies earlier were not open to talking about social media practices in their conferences.
Yeah.
But now since the last year, we have had so many panels in every meeting on specifically one panel on social media, and every age group or every like a very senior doctor to someone who's very new in the field are all represented in those panels. So we have someone who's a postgraduate to someone who's almost
practicing decades.
three decades senior to me.
Wow.
It's all in the same panel, which is amazing.
Yeah. And I also feel that with social media, we are more comfortable with doctors. Like now we don't see doctors as those doctors. There was always that gap, you go to a doctor when things get worse. But now I feel there's the gap has reduced and there's a bridge between what they want to do and what they.
Yeah, I don't know about other departments of how sort of the ice breaking works in them. I know the general concept, how it works. You take the history.
Yeah.
In fertility, the ice breaking is very important because, I mean, there was an incident when I was talking to the patients who had come, and I asked a question because they were trying for babies. I was like, "How often do you do it in a month?"
Yeah.
The wife says thrice per month, and the husband says 4 times a week. I was like, "How is it happening?"
Is it a different person?
But like the men have this habit to exaggerate.
Because I guess why is that connected to their ego, like their existence? Why is their fertility or the sex life connected to who a man is?
It's the masculinity and I think it's people who are insecure about the masculinity. For them, it shows. For people who are pretty secure about the masculinity, they would not mind accepting whatever the truth is.
Yeah.
So, but either way, I think what social media has now done is that before they come, they would always look at Google and they would get redirected to the social media. They will get familiar with the face, the way of talking, and what the doctor sort of speaks about or represents.
Right.
So they will get used to it. So by the time they come, they're already more open to talk about their lives. Because in fertility, you first have to go through the barriers and the taboo and then actually lead to the treatment side. So that for us is now a little lowered. That fear and that insecurity is now a little lowered. So now they are much more open. That I think is a very positive thing.
Yeah. Do you think you being the younger generation and you spoke about your dad, does it make a difference because you are out there, your face is out there and you're now popular enough?
Yeah, I mean, it does make a difference. There are people who still want to come and meet me, and my dad usually goes के अरे मैं बाप हूँ उसका
मैंने पढ़ाया है इसको
तो मैं ही करने वाला हूँ वो he'll look at your embryos and eggs and sperms बाहर का सारा काम मैं ही करने वाला हूँ इधर ही बैठो तुम पहले but it's always fun it's it's I mean they see my dad as I mean to get out of his shadow was also one of the reasons I did social media like I didn't want to be because he's been around for a longer time. He's one of the first ones in Rajasthan and the western part of the country, so that was pretty important for me. Now that I mean since 2019 I have been recognized as a separate person. There are people in conferences introducing me to my father, so
so
that's really fun. Yeah,
you got it. You're there.
Yeah, but Yeah, like it's the change in mindsets.
Yeah.
From people who don't want to be on social media to people who are on social media. It's fun. It's a fun
It's fun.
dynamic.
Yeah. I guess social media connected us. So yes.
Yeah,
Yes for social media. And yes to all the doctors who are on social media.
absolutely.
Yeah.
Absolutely. The more the merrier.
So you spoke about the book. You
Yeah.
gave us the secret that you're writing a book. I guess it's going to be around, I believe, and I'm sure it's going to be around fertility.
Yeah.
But can you give us more insights?
So it's specifically for men's sexual health and men's fertility.
Mm-hmm.
And I would have more usable and practical information in there rather than theory. Theory would be there, but
Yeah.
something that they can, take away with them.
And when is it going to be out?
It should have been launched in 2024, but yeah, I'm pretty slow. So I'm hoping this year end or 26 January.
Yeah, I like it how you said the book is more focused for men.
Oh yeah,
And I hope they take it up because women already have a lot of burden. So you better get going.
it was so funny that when I was looking for source material to research and read,
There's nothing.
there was very little amount of published books for general public. Medical content to hai, but
Yeah.
for general public was very less.
Yeah. And when you say practical, it's like on a regular basis what they can
Yeah,
do.
something that because a lot of times when we read medical textbooks for general people, it's a lot of theory. It's a lot of what happens in your body, but what do you do with it?
Yeah.
You have taken that information, now what? So I would try and include as many practical tips as possible. I don't know how it will work out, how the structured book will come out, but that is my idea, that I want to include topics that people can actually apply in their lives.
And I just want to know your maximum following on social media. Is it men or women?
It's actually 51% are women, 49% are.
That's so close.
It's always stayed the same. Like it hasn't fluctuated at all. It has been 51, 49, 50, 50. That's the range it stays.
That's a very good thing. That's good news because
amazing.
It shouldn't be again women who are dragging their husbands to the clinic for things. Okay, that's a good thing. Yeah. Okay, great. Thank you. Thank you so much. I guess that was a lot of information. It was fun and I hope you also enjoyed it.
Thank you. It was a lot of fun. And thank you for having me. And finally catching up.
Yes, finally.
After years.
5 years of texting. Hey, let's catch up. So yes, I guess next time it should be me interviewing your dad then. And like, batao, kahan se sikhaya?
He's the original.
Yeah. And when your book is out, then we should talk about that too.
Yeah. Fingers crossed.
Yes. All the best for that.
Thank you.
Yeah. Thank you for your support, and we look forward to getting great wisdom and expert to you from our YouTube channel and Spotify. Subscribe now.